Good morning, students. Today we are going to discuss with a new topic from neurovascular disorder unit, that is third unit. The topic name is headache. Let me introduce the topic. Headache is one of the most common of all human physical complaints. Headache is actually a symptom rather than a disease, a stress response, vasodilation, skeletal muscle tension, or a combination of factors. So, a headache is not a disease, it is a symptom rather than a disease. Headache is a symptom which shows a stress response when you have become more stressed or when your anxiety is increasing. So, that time headache will show. Then, if there is a vasodilation, increased blood circulation in the head, especially in migraine, then if there is a skeletal muscle tension, if more compression is occurring in the brain, especially in case of brain tumor or in neoplasms, then combination of factors, certain combined factor also can lead to headache. So it is the most common of all human physical complaint. Let us see the definitions. Headache is also known as cephalalgia. It is a symptom of pain anywhere in a region of the head or neck or scalp. So, headache, the other term for medical terminology of headache is cephalalgia. It is a symptom of pain anywhere in a region of the head or neck. Headache is defined as pain in head that is located above the eye or ears, behind the head, or in back of upper neck. So these are the common regions from where headache can or the pain which is occurring on this area we can call it as headache. Okay. Let us see the types. Types of headache are tension type headache, migraine headache, cluster headache, and other types of headache. So these are the four main types. Let us see one by one. First of all, tension type headache. It is a most common type of headache. Is characterized by bilateral location. Okay, more than one location, it will be affected, and it's one of the common type of headache. It is usually mild or moderate intensity and not aggravated by physical activity. It is seen in mild and moderate intensity or severity, and it is usually it is not aggravating by or increasing by any physical activity. Tension type headache is subcategorized as infrequent, episodic, frequent, episodic, and chronic. So these are the subtype of tension type headache. Let us see the causes of tension type headache. It caused due to sustained pain, full contraction of the muscles of the scalp and neck. So tension means from the word itself we can understand that when there is a some kind of compression or contraction is occurring on the muscles. So here this pain is occurring due to contraction of muscles of the scalp and neck. When the muscles of the scalp and neck is getting contracted, that can lead to tension type headache. Signs and symptoms including headache does not involve nausea or vomiting. Nausea and vomiting will not be there. But photophobia means person will be sensitive to light, and phonophobia sensitive to sound. Then second one is migraine headache. All of you familiar with migraine, okay, and it is very commonly seen in teenage girls and all. Migraine headache is a recurring pain characterized by unilateral, bilateral throbbing pain. It's a characteristic of the brain is throbbing. Something is pricking like that sensation will be there. So it's a recurring or again means a reoccurrence will be there in this type of headache, and it can be unilateral or bilateral. Either it can occur on one part of the head or multi or different parts of the head. Migraine type of headache occurs more in females than males. The incidence ratio is more in females than males. It is associated with anatomical or nervous system dysfunction. So migraine, the cause of the migraine headache is unknown. Primary cause is unknown. It can be associated with any anatomical or structural or because of any nervous system dysfunction. The main causes are certain theories are suggesting different causes like vascular theory, vasoconstriction followed by vasodilation with resulting in changes in blood flow causing the throbbing of pain. So we have seen that one of the characteristics of migraine headache is throbbing. Okay, so this throbbing is mainly occurring due to intermittent vasoconstriction and vasodilation. So after a vasoconstriction followed by a vasodilation, that can lead to changes in the blood flow. So when changes in blood flow is occurring, that time the throbbing or a wave-like formation is occurring. Second theory says that pain is result from muscular tension and is reversible. Okay, that is the second theory is telling about pain is due to muscular tension. Then third theory is telling that biochemical changes in serotonin level. Okay, in our brain, serotonin neurotransmitters are there. Because of any changes in neurotransmitter, the pain is occurring. Then signs and symptoms, including signs and symptoms, is classified by migraine without aura, that is formerly called common migraine. Migraine without aura is the most common type of headache. And second one is migraine with aura. Two classifications are there: migraine without aura and migraine with aura. It occurs in only 10% of migraine headache. Aura means feeling of pain before it start. Okay, so in some cases before starting pain will be there. In some migraine cases, before starting migraine, so soon after starting migraine, pain will be there. It lasts for 10 to 30 minutes before the start of headache. So in migraine with aura, in that they will have a feeling of pain before the migraine attack. Okay, means around 10 to 30 minutes before the migraine attack, they will start the symptoms or sign of pain, and may include sensory dysfunction like visual field defects, tingling or burning sensation, and paresthesia. Then motor dysfunctions like weakness, paralysis, dizziness, confusion, and loss of consciousness. So these are the common symptoms you can see in migraine headache. Let us see cluster headache. It involves repeated headaches that can occur for weeks to months at a time, followed by a period of remission. Okay, so in this one also, migraine headache also, there is will be some remission will be there. So it means relapsing. Okay, so once a headache is occur, afterwards it will be after some time it will be relieved, and again it will start. So same here, cluster headache means, cluster means a group, so it's repeated headache. Group means here it is mentioned as repeated. Okay, again and again it is occurring, that can occur for weeks to months. Sometimes it will be takes weeks to months at a time, followed by a period of remission. Okay, so it will be relapsing or relieving, then again it will be starting. Signs and symptoms are pain around the eye, forehead, cheeks, nose, or gums. So these are the main area where cluster headache is occurring. Then swelling around the eye. Okay, periorbital swelling will be there. Facial flushing. Okay, when you can see that some flushing over the face. Then other type headache, it's we can call the secondary headache. This type of headache may be the first symptoms of other illness. For example, if you're having some gastric problem, or if you're having some stomach upset, or if you're having some body pain, along with this primary factor, you're having a or a secondary factor, you are having a primary sign of headache. So, or if you are having some sinusitis or some other diseases, okay, any systemic diseases, because of the systemic disease, one of primary cause or primary sign will be the headache. So, if the primary sign is a headache, for a secondary or underlying condition, that we can call it as secondary headache. It should be due to some other illness such as subarachnoid hemorrhage, brain tumors, trigeminal neuralgia, and any other systemic disease. The exact factor or the cause will be some other disease. But for that other disease, the primary sign will be headache. So let us see a pathophysiology. The exact cause is not mentioned anywhere. So here the pathophysiology are explaining for a headache, that is vascular theory. So here they are mentioning that intracranial or extracranial blood vessel dilation. So when the blood vessel is getting dilated, more blood will be flushing in the brain. So that can lead to headache. Intracerebral blood vessel vasoconstriction, that can lead to aura. Okay, or before starting the headache, the people will feel some kind of pain. Then serotonin theory, I told that it's a neurotransmitter. Decreased serotonin level linked to migraine. Specific serotonin receptor found in blood vessel of brain. Okay, because of changes in serotonin level. So exact cause is unknown. That's why the pathophysiology is not mentioned anywhere. Then diagnostic test, or how we can diagnose, is first of all history taking, then physical examination, we have to take a complete history about the person, whether they are having any kind of tumor, brain tumor, or any secondary illness, whether they are taking any medications or so like that. History we have to take properly. Then physical examination, all the head to foot examination we have to do. Then electromyography test reveals the sustained contraction of muscles of the neck, face, and scalp. So through electromyography, it is a study of the muscles. It helps to identify whether any muscle is contracted. Then neurological examination should be done, and CT scan and MRI. CT scan and MRI will helps to identify the underlying factors. For example, any tumor or any cancer that we can identify, or if there is any bleeding or any hematoma, that also we can identify. Severity and intensity we can identify through with the help of CT scan and MRI. Then next is a management, non-pharmacological management, including identification of trigger. First of all, we have to identify what is a triggering factor which can lead to headache. Second one is meditation. Meditation also helps to relieve from headache, relaxation training, then psychotherapy. So these are the certain non-pharmacological management which help for relieving headache. Then pharmacology therapy, it is mainly abortive therapy and preventive therapy. Let us see one by one. Abortive therapy, in that non-specific treatment is there, it including aspirin, paracetamol, ibuprofen, then diclofenac and naproxen. Okay, these are the medicine which we are using for headache in the non-specific treatment, and the route of administration and dose also given here. Then specific treatment including ergot alkaloids, ergotamine, dehydroergotamine, then 5-HT receptor agonist including sumatriptan and risatriptan. Okay, these are the medicine we are giving for specific as a specific treatment for headache. Okay, then preventive therapy including beta blockers. Okay, it will helps to prevent headache. Then calcium if you are having any underlying disease condition, so that we can provide beta blockers, example propranolol. Then calcium channel blockers, example flunarizine and verapamil. Then TCAs including amitriptyline. Then SSRIs, that is fluoxetine. Okay, these are the medicine which we are giving for this SSRIs is serotonin release inhibitors. Okay, so these are the medicine which we are giving as a preventive therapy for headache. Then other management including prevention. Preventive medical management of migraine involves daily use of one or more agents that are thought to block the physiologic events leading to an attack. So, as a prevention, you can take the preventive medications, either one or more agent you can use. It will help to block the physiologic events or functional impairment which can lead to headache. There are several proven or widely used medicine for the prevention of migraine. Two beta blocking agents, propranolol and metoprolol, inhibit the action of beta receptors cells in the heart and brain that control the dilation of blood vessels. So we have seen as a preventive therapy, we have seen that this beta blocking agents. So this will help to inhibit the action or stop the action of beta receptors, so that the blood vessel dilation will inhibit or stop. Then calcium antagonist, okay, that is also helpful. Then cluster headaches are unilateral and come in cluster of 1 to 8 daily, means 1 to 8 times per day, with pain localized to the eye and orbit and radiating the facial and temporal region. So that is one of the specialty of cluster headache. Then collaborative management including certain therapies are useful for reducing the headache, including yoga, acupuncture, stress management, and muscle relaxation training. This also helpful to relieve from or reducing the headache. So these are the management for headache. The nursing management is the goal of nursing management are to enhance pain relief. We have to enhance or we have to take some necessary implementation or intervention for pain relief. It is reasonable to try non-pharmacologic intervention. Okay. So first of all, we have to try for non-pharmacologic intervention like relaxation therapy, then stress, yoga, meditation. This will psychotherapy will helps to relieve the headache. First, but the use of pharmacology should not be delayed. So, first of all, you have to use non-pharmacological management, and if it is not relieving, then we have to go for pharmacologic management. The goal is to treat the acute event of headache and to prevent recurrent episode. So, the main goal is to treat the acute event of headache and to prevent recurrent episodes. So this all about the topic headache. So we have seen that what do you mean by headache. The other term for headache is cephalalgia, and we have seen what are the types of headache. Mainly four types are there. We have seen in detail about the types, its causes and signs and symptoms, and we have seen how to diagnose. Then what are the management for headache, pharmacology and non-pharmacological management, and afterwards we have seen the nursing management. I hope all of you clear about today's topic. Have a nice day. Thank you.